the best way for me to cram the rest of this stuff in my head. This is going to be on the meds for rheumatoid arthritis, gout, antimicrobial drug general information. Let's see what else we got here. Antibacterials, and other antimicrobials like antiviral, antiprotozoal drugs, antiretroviral drugs, antiparasitic drugs, and damn, this shit don't stop. And then you have your antibiotic drugs, like you have your inhibit cell wall synthesis drugs, inhibit protein synthesis drugs. You have your inhibit nucleic acid synthesis drugs. You have your urinary drugs, and have your TB drugs. So we're just gonna go through the drugs. All right. First off, rheumatoid arthritis. It's a systematic autoimmune inflammatory disease. It affects all ages. It's treated with DMARDs and NSAIDs. DMARDs are disease modifying anti-rheumatic drugs. That's what DMARDs stand for. DMARDs is disease modifying anti-rheumatic drugs. But they treat like the underlying cause, but usually NSAIDs are much safer than DMARDs. Another thing that treats rheumatoid arthritis is also glucocorticoids, but NSAIDs are still safer. So, in conclusion of that is NSAIDs are much safer than glucocorticoids and DMARDs. Okay, DMARDs they are usually used in conjunction with salicylates, which is basically aspirin and NSAIDs, and some monotherapy like monoclonal antibody therapy or something like that. I think that's what it's called. All right. So the first drug for rheumatoid arthritis is methotrexate or Rheumatrex. It's a non-biologic DMARD. It acts quickly. It's considered DMARD's first choice. It has a folate antibody metabolites and is used in treating various malignancies and rheumatoid arthritis. It inhibits enzyme necessary for folic acid to synthesis and activation. The contraindications for methotrexate is immunosuppression. So if you have any kind of immunosuppressive disease, like if you have AIDS, HIV, if you're on chemo, it's contraindicated. Also, if you have blood dyscrasia and if you're pregnant, it's contraindicated. The adverse effects is for methotrexate is liver fibrosis, pneumonitis, GI ulcers, headache, nausea, vomiting, diarrhea, suppression of bone marrow. So, and nephrotoxicity. Do not take this drug with alcohol at all. And it has a lot of other interactions as well. But if you do take it with alcohol, expect to get hematotoxicity or liver toxic liver. Um, you want to give with caution to young and elderly. Strict birth control for women of childbearing age. Um, and then the dosage, you want to take this uh, once a week, and you want to drink a lot of water because you don't want that shit to circulate in your system over and over and over again. Kind of toxic. So drink a lot of water. It says 10 to 12 glasses a day. All right, next. Well, not next. Um, so more on methotrexate. High doses can interfere with drug effectiveness. No more than 5 milligrams of multivitamin. Damn, so you really can't take shit with this. It can cause a photosensitivity, and you want to monitor temperature. All right, it's considered the fast acting DMARD, and a therapeutic effect will begin between 3 to 6 weeks. Major toxicities can cause hepatic fibrosis, um, bone marrow suppression. I think that's because of the it inhibits the folate synthesis. GI ulceration, pneumonitis, periodic testing of liver and kidney function, CBC, and platelets mandatory. So that's what you have to evaluate when you're on this drug. Etanercept or Enbrel is a so methotrexate was a non-biologic. This one is a biologic DMARS and neutralizes TNF, the tumor necrosis factor. The shit that's a cytokine. It tells everybody what to do and shit. It suppresses that. Well, it neutralizes that. It suppresses the autoimmune attack on joints. It's basically like I said, TNF inhibitor or tumor necrosis factor inhibitor. It binds specifically to circulating TNF. It prevents TNF from binding. It prevents TNF cell response. It binds specifically to circulating TNF. So, etanercept basically and TNF are they love each other. Well, they actually don't love each other. They're enemies. They're like the Bloods and the Crips. Fucking TNF trying to get away, and etanercept is like hell no. So etanercept prevents TNF from binding. It prevents TNF from cell response. Like TNF can't do shit. Um, Adverse effects. Injection site. You get in the adverse effects of etanercept is injection site infections. Um, I don't know what UPI is. You also get headache, nausea, and rhinitis. Serious adverse infection is induction of demyelinating diseases and blood dichrasis. Risk for infection related to potential depression of bone marrow function and dyscrasias. Um, Administer, you want to rotate injection sites because it's a sub-Q injection. You want to use septic technique. I'm sorry, you want to use aseptic technique. Don't administer if cloudy or discolored. So don't give the shit if it's cloudy or covered. Do not administer live virus vaccinations. It's contraindicated for people with active infections like TB, HBV, heart failure, demyelinating disorders. Caution, you want to caution with patients that are immunosuppressed, um, have diabetes, mild heart failure, liver dysfunction, latent TB, and HBV, and a history of recurrent infections. Um, Gout. So that's it with in, inter, intercept. Next is gout. So gout is a disease of the purine metabolism and occurs with hyperuricemia. So you got a shit ton of uric acid in your bloodstream. Um, so you get acute gout pain or acute gout attack is rapid. Is rapid swelling of joints, erythema, and severe pain. So they diagnose it through synovial fluid analysis. The first line of treatment are NSAIDs. So for gout, the first line of treatment, just like rheumatoid arthritis, first thing you want to do is give them some NSAIDs. Okay. The second line of defense is colchicine and glucocorticoid steroids or glucocorticoids. Sorry. But you never want to take the NSAIDs and the glucocorticoids together. So if you're going to take two drugs together, then if you give an NSAID, then you can't give a glucocorticoid. And if you give a glucocorticoid, you can't give an NSAID. All right? Allopurinol and probenecid is used for prevention. So those are the prevention drugs. And they don't help in the acute gout attacks. Allopurinol, the allopurinol drug of choice for chronic. Allopurinol drug is the drug of choice for chronic gout. It lowers the plasma uric acid and stops production. Probenecid lowers plasma uric level by promoting excretion. It inhibits reabsorption. When you're taking, when you have gout, you want to avoid beer, ale, or wine because it can cause a sudden attack. You want to increase your fluid intake because it increases uric acid excretion. And you want to avoid high purine food like smoked meats, sweetbreads, anchovies, sardines, and organ meats. All right? So that's what you want to do with gout. So we're going to talk about the medication that is used to treat gout. The second line treatment that's used is colchicine. It is a second choice drug. It's taken at first sign and stopped when signs and symptoms of gout are gone. It's for acute gout attacks. It inhibits the activity of leukocytes that digest uric acid crystals. It inhibits inflammation and reduces pain and swelling. Signs and symptoms are, like a lot of them, nausea and vomiting, diarrhea, abdominal pain, paralytic ileus, and possible liver and kidney impairment. You want to administer this when you give this drug, colchicine. You want to, I don't even know if I said that shit right, but when you give this drug, you want to give it with a full glass of water at evenly spaced intervals throughout the day. And you also want to be on a low purine diet and restrict alcohol. And you have to give it to the elderly. You want to be very cautious. Colchicine, like I said before, it's an acute gout attack. All right. Allopurinol is for chronic gout. It increases production of uric acid. And like I said, it's chronic. Allopurinol is chronic. It decreases production of uric acid. The adverse effects is pruritus, that's itching, macular papular rash, nausea and vomiting. You'll get elevated liver enzymes, acute gout symptoms, and kidney impairment. Drug interactions. It interacts with a lot of damn drugs. Just like, just like the rheumatoid arthritis drug. I forgot the name of it. Damn, already. What's the name of the drug? The rheumatoid arthritis drug that you can't mix with shit. Methyl. Yeah, methotrexate. Rheumatoid arthritis drug. It's just like, oh, allopurinol. It's just like allopurinol. You can't mix it with a lot of drugs. The next drug is probenecid, and I think it's also for chronic. It blocks renal uptake of uric acid. All right. Adverse effects is headache, rash, and kidney stones. You get blood, dyscrasias, GI upset, and abdominal pain. Okay. Next, moving right along is shit. We were saying that like I only got a page left. I got more than a damn page. Gotta get busy. All right. So antimicrobial drug general information. So for the antimicrobials or antibiotics that inhibit cell wall synthesis, those are cephalosporin, daptomycin, penicillin, and vancomycin. So, I'm trying to think of a way to remember that. That'd be CDPV. Okay, I think I got it. I won't say it on here, but I think I got it. It's kind of nasty. Well, it is nasty. Yes, but it goes with it. All right, next. The drugs or the drug classes that inhibit protein synthesis are aminoglycosides, chlorophenicol, clindamycin, erythromycin, and tetracycline. Those are the antimicrobials that inhibit protein synthesis. The drug classes that inhibit nucleic synthesis is fluoroquinolones and rifampin. So the drug classes that inhibit nucleic acid synthesis is fluoroquinolones and rifampin. All right. Then what you have next is the drug group that disrupts cell membrane permeability. That's polymyxins, polyene, antimicrobials, and imidazole. Next, the group is they work as anti-metabolites, and that's sulfonamides, trimethoprim, and last but not least is this drug class inhibits viral enzymes, and that's aclavir and sequinavir. All right. So you have resistant, which is smart bacteria. They escape death. They can live in the presence of antibodies. They're due to overuse. Not all bacteria is killed. They change up their DNA. So they keep changing up on your ass. It's hard for them to get killed. So that's how they keep surviving. match the drug with the bug. So you need to identify the bug before you administer the drug. All right, so peak and throw. Peak and throw is peak and throws. Peak and throw is they keep serum drug levels within therapeutic margin or range. Culture and sensitivity. A common test to identify drug and susceptibility. Um, and then you have drug spectrum. So basically, culture and sensitivity is a common test to identify drug and susceptibility, and also look at the drug spectrum. It chooses a drug with a narrow spectrum, so least invasive. Superinfections. Superinfections are a new infection that occurs during the course of a treatment for a primary infection. So, like when you're knocking out knocking out not a medication, but knocking out bacteria, and you're knocking out bacteria, but you're also knocking out your normal flora, and then that's when you have a super infection because it gives the opportunist drugs an opportunity to start attacking. All right. Empiric therapy is prescribing antibiotic treatment before the pathogen has been definitively identified. Doctors do this shit all the time. It's kind of based off of its symptoms. So antimicrobial therapy. You want to monitor super infections, evaluate renal and liver function. There's diarrhea. You want to inform the PCP before taking other meds. Cultures are prior to initial dose. Avoid alcohol. Ask about allergies. Take full course of therapy and evaluate cultures, temperature, and blood counts.